Hello, my name is Dr. David Traver, and I will be speaking on medical issues spanning the lifespan in individuals who have autism. I have two main objectives in this presentation. One is to provide an awareness of the diverse number of medical and health-related conditions which parents, caregivers, and even healthcare providers may not recognize individuals with autism face. And number two is to try to offer some practical measures and resources to support the healthcare transition to adult-centered care. Medical transitions for autism is a very daunting subject. It has been estimated that in the next decade, up to 1 million or more individuals who are teenagers will enter adulthood and age out of the school-based autism services, which is the main source of this kind of support. They call it stepping off the service ledge. And it has been estimated as well that 50,000 individuals, youth, boys and girls on the spectrum are turning 18 every year. About half of these have a coexisting medical condition, and about little over half of these who are 15 to 17 years old have at least two medical conditions in addition to their spectrum diagnosis. Some of these include intellectual disability, mental health conditions, ADHD, and epilepsy, and there are many more that we're going to be discussing today. The bottom line is that better healthcare transition and more comprehensive healthcare in young adulthood has the potential to really provide better outcomes in the long haul for people across the lifespan. What is transitioning? What it really is the process of moving from a child slash family centered model of providing medical services to an adult patient centered model of healthcare with or without transferring to another provider. And this, of course, involves planning, care, and then a lot of integration into that network. I'm going to provide a structure for today, and that is basically 4 points. The challenges in transitioning, the diagnostic challenges the logistical challenges, the diagnostic challenges, and then we'll go into the medical conditions, which is a mainstay of helping people be aware of the many issues these individuals face that are often not recognized, and we'll round it out with resources. We'll start out with a number of the conditions that medical providers who care for these individuals have been aware of up to now. And then what I'm going to do is present two recent studies, actually that came out this year, that build on and quite significantly expand our current understanding of the medical conditions those on the spectrum face. We'll close with resources and what to do to offer better care with those who have this set of conditions. There are logistical challenges to transitioning. Many of these are intuitively understood by family members who care for these individuals. Oftentimes, it's very difficult to find a medical professional who understands. Most of these people are not trained in autism care. They don't have the time. It requires much more time than the available managed care slots often allow. There's often a lack of financial reimbursement. The system does not offer commensurate reimbursement for the time that is spent. A crisis point here is the emergency room, and many of these people often face distressing episodes of behavioral disintegration or some other kind of medical challenge that the family just simply does not know how to handle. They take them to the ER. The ER, in addition, may not be well trained. But what a lot of families don't know is that the ER physicians often, after the acute episode is somewhat addressed, they often rely on the primary care provider following discharge to follow up on these patients. And for many of these patients, they don't have adequate providers to do so. So that ends up actually creating a yo-yo situation where the patient goes back and forth from the ER bouncing back because they just simply don't have a good medical home as it is. Insurance, of course, it goes unsaid. There's low reimbursement for many of these individuals. A lot of these conditions are not well reimbursed. And sometimes the wait time to get any kind of provider lasts months. This is unacceptable. And the real key here for all of us is to be aware of the medical and the mental conditions that these folks face so we can help yes, even provide some level of awareness or education to the medical system, believe it or not. A lot of these, unfortunately, our individuals face many uphill battles, whether it's the paperwork or, as I've mentioned here, the lack of preparation by the providers. It is very difficult. Aside from the logistical challenges in the system, the medical diagnoses themselves are daunting. Many of these folks actually present with clinical pictures that do not represent what may be happening in their body. An example of this is self-injurious behavior. Although we still are trying to understand this, many individuals who experience SIB, we'll term it that, self-injurious behavior, warrant a very low threshold of suspicion for pain-based behavior. Some of these individuals may hit their head on the side and they may bounce their head against the wall. A number of these folks have been found to have cavities or abscesses in their gums. Some of these individuals will actually hit their head, but what this is our actual case reviews, they will actually hit their head, and when they are actually able to communicate what little they might be able to verbalize, they say something like head hurt, head hurt. Actually, their head hurts, but what they're really struggling with in the situation is gastric pain or spasm or even reflux. A lot of these individuals may have arching, they may stretch their neck, they may have gulping, they may experience lots of fluids that are being taken in, and that may actually be from acid reflux that's bothering them, heartburn. So we have to be aware that this, plus even posturing and abdominal pressure application, can actually be from intestinal pain, from stool retention. You have to think of intermittent bowel obstruction. Some of these individuals may actually pass stool or have bowel movements occasionally, but that does not free them from having spasms and incredible abdominal pain. This has to be considered, and in some cases, x-rays have to be taken. Appendicitis, believe it or not, has even been found in individuals who have suffered and bitten themselves on their arms, on their wrists. This kind of behavior is typically not just because someone is having a bad day. There are reasons. Upper extremity flailing, a number of these individuals will almost have ballistic-like movements with their arms, and this can actually be from a loss or alteration of what we call proprioception, which is basically governed by the cerebellum in the back of the head. We know this is a part of the brain that is not typical in many of these individuals. And this, of course, is where these folks do not know where their arms are. It's akin, perhaps, the best we might analogize it to is when our arms fall asleep. We've been lying on them in our sleep, and we have to shake them. We have to move them. And this is, as you might guess, very uncomfortable. And it's something that they often manifest through flailing of arms or legs. And finally, skin scratching or skin picking. This is something to be aware of. A number of these folks can actually have, it's been described, my skin is on fire. I feel like there are ants under my skin. This is actually what people on the spectrum communicate once they're able to, either through assistive technology or through verbalization, help get out. And this helps us understand why people will be picking and scratching and excoriating their skin in such a way. There are things that can be done for all of these situations. That's the main message here. The provider who knows the patient and their body well is the person who you need. Whether it's being able to understand what reflux might be, tapping on the chest, being able to offer reflux medication, apple cider vinegar, probiotics for a lot of these gastric issues. A deep abdominal pressure may signal the need for an x-ray, as I said. There are supplements and medications that can be provided. And this is what these individuals deserve in terms of the kind of evaluation that they require when they go to these urgent care facilities or primary care clinics. A number of doctors throughout the years who have decided that they will see these individuals understand medication management is a challenge, making sure these individuals have the kind of consistency for the sensory issues in their mouth that prohibit them from taking medication in a certain route of delivery or preparation. They understand that they may have GI morbidities. We've talked about that. Sleep disorders, obstructive sleep apnea. They may need CPAP machines, and of course, the dental care. These are things I'm just going over to make sure that people understand always have to be kept in the back of someone's mind when they're experiencing a change in behavior. It's not, again, simply because they have a bad day or they don't like the weather. A number of these other issues like seizures, tardive dyskinesia, which are abnormal body movements as a result of often antipsychotic medication, hearing and vision issues, the inability to focus, to fix and focus on certain areas when they are not able to look at a target, they will actually look away. That's not because they're being difficult people, it's because they cannot look at the area that you're requesting them to focus on the same way we can. They have to actually look off center. And of course, obesity remains an issue. Some of these seizures that we have to think about are nighttime seizures like Landau-Kleffner. We have to think of juvenile myoclonic epilepsy. These are specific medical conditions that have seizure formation. I'm not going to go into that right now, but these are things that have to be kept in mind when someone is having symptomatology like this. And a doctor who's aware of this can be of great help. Of course, that would you'd start with the neurologist, but the primary care doctor has to be the person who pulls the trigger. Medical conditions also include preventative care, and many of these not only involve metabolic issues like diabetes, but I'm going to park here just for a second on the idea that many female patients are underserved. They require and they deserve appropriate screening for breast and cervical cancers, especially for issues like periods. Many of these individuals suffer greatly from the inflammation that is inordinate in their periods. They can disrupt behavior, it can disrupt sleep, it can cause great distress, and many of the treatments that are available are underutilized. So when a female patient, an individual, has behavioral challenges, please think about some of these issues and make sure that they get screened or looked at. They deserve the same and perhaps even more scrutinizing care by the appropriate medical professional, GYN, etc. Mental conditions as well are obviously on the table, whether it be isolation, anxiety, and depression. The stress often becomes unbearable. And so please keep these other conditions in mind that the individual on the spectrum may carry and manifest in increasing measure. This year, 2 papers came out that expand everything we've already just touched on. And the reason we're going to look at these is because the magnitude of conditions and the diverse number of conditions deserves to be recognized. And this will provide better care for all those who are struggling with not just issues on the spectrum, but so many comorbidities. This year, out of Sweden, the Karolinska Institute came a longitudinal retrospective, meaning they looked at records, population-based study of individuals born between 1932 and 1967. The follow-up was a little over 8 years. And they looked at of 4 million adults, about 5,300 had autism. About 1,900 of these were women, 3,300 were men, and they calculated the cumulative index, which is a measurement of that predicts the risk of a disease or an event over a short or long period of time. Of course, that would be relevant to the conditions they looked at. And they also looked at hazard ratios, which is the equivalent to the odds that somebody in question in the group will have a lot more high likelihood of suffering from that condition or not compared to someone who's control. What they found was quite startling. They found medical conditions and injuries higher for autistic than non-autistic individuals for 15 of 39 conditions. Among these were 89% increased risk for heart failure, twice the risk for bladder infection or inflammation of the bladder, almost 3 times the risk for both glucose dysregulation and iron deficiency anemia, as you can imagine how this might go unnoticed. And they had a variety of other conditions such as GI, esophageal, stomach and intestinal issues, metabolic, type 2 diabetes, and even skeletal issues, including inflammation of the joints, arthritis, and spinal problems. I didn't put it on here, but they also found, I believe, double the risk almost for chronic obstructive pulmonary disease. And this harkens back to something I read many years ago, where these individuals actually are known to have lung abnormalities, something that is not fully appreciated by many doctors taking care of these patients on an acute care basis. Liu, the primary author of the study, found the highest cumulative index for incidence for bodily injuries. An alarming 7 times the risk for self-harm was observed. Poisoning was almost 5 times the risk for non-autistic individuals. Falls and physical injuries ranked high as well. And these existed, and the differences persisted rather, regardless of whether the individual had intellectual disability or what sex they were, female or male. That made no difference. The second study that came out of Europe was out of the UK, at the University of Cambridge. And this was by John Ward. And he looked at something that resonated from a previous study in last year, where it was noted that autistic individuals appear to pass to die far younger than others. This was from the Journal of the American Medical Association in Pediatrics, 2022. And at the time, most doctors thought and continue to think that these individuals just have specific conditions, a few of them, like GI pain, sleep, and more that characterize them. So that more of kind of a cadre of issues specific to autism. Well, what Dr. Ward and again, Dr. Liu have found is, and Ward's study expands even what Liu found, they found that these individuals have much higher rates of what we're going to term chronic physical health conditions, CPHC, across the whole body and are more likely to have complex health needs than previously thought. 60 health conditions across 9 organ systems were examined by Ward and his group, including gastrointestinal, endocrine, rheumatologic, neurologic, ocular, kidney, liver, renal, hepatic, head and neck, ear, nose, and throat, hematologic, and dermatologic, skin. They found that there were more diagnosed conditions across all 9 organ systems in the 1,100 autistic individuals they looked at compared to the 1,100 non-autistic individuals who are aged, by the way, 16 to 90 years of age. Before I go on, I'm sorry for going too fast. There are higher rates of 33 of these conditions compared to non-autistic peers. These included celiac disease, gallbladder disease, endometriosis, fainting, syncope, vertigo, dizziness, urinary incontinence, eczema, and iron deficiency anemia, resonant of Liu's study. They also found, very interestingly, that females with autism had a much higher prevalence of something called EDS, Ehlers-Danlos syndrome. Some of you may recognize this as the colloquial term is rubber man syndrome, where you have skin that is much abnormally stretchy compared to the typical person. They have connective tissue disorder that unfortunately allows for hypermobile, loose, easily dislocated, painful joints. As I mentioned, the skin is very easily distended. It's bruised. Wounds do not heal in the normal time. They often even have organ prolapse and hernias. So organs can be dislodged. Hernias are common. You should be thinking about this if you know somebody who has this kind of clinical picture and they need to be evaluated for this. Digestive problems, dizziness, and fatigue are also a result of this syndrome. They finally found high rates of something called CSS, which is central sensitivity syndrome. This is a set of conditions where you have dysregulation or imbalance of the central nervous system signaling. Some of these conditions you may recognize as irritable bowel syndrome, temporal mandibular joint syndrome, TMJ, migraines, ear ringing, tinnitus, chronic fatigue syndrome, fibromyalgia, pelvic pain syndrome in women. These are conditions for which there's no quick fix, but this is something that's found much more commonly in individuals on the spectrum. And they found that these individuals had combinations of these conditions that were very unique. Even though you might think that a neurotypical person has some of these in combination, that might be the case, but they found specific patterns in individuals with autism, showing once again that there's an underlying mechanism behind this. So, what do we do besides get tempted to get overwhelmed? Well, we look at the proactive measures that can be instituted. Proactive measures include a family awareness and advocacy that the family and caregivers can provide, where a proactive role is taken to be able to offer literature and awareness from some of the kinds of information we're discussing here today, providing regular checkups, not waiting till there's an emergency or a disintegration of behavior. Home visits are key. Being able to provide encounters in the comfort of one's home or a familiar environment cannot be understated. The value of that is immense. This continuity of care model I'm about to discuss is where somebody is offered care from the same person throughout their years from both a pediatric and adult perspective. This is seen in conditions such as congenital heart disease, sickle cell anemia, cystic fibrosis. This is not a new model, and this is something that is available to people on the spectrum if you make the right choices. And this is somebody who hopefully, when you make this choice, has a functional medicine background or familiarity, not just a traditional one, because many more tools are available in the toolbox if they have a functional medicine background. One of some practical suggestions I'm offering here, the healthcare team should include a primary care provider, of course, somebody who has become familiar with that person's health, their body, their patterns of disease. The team, I repeat the word team, should include people who are both have a psychiatric knowledge, a neurologist. Dr. Bauman in Boston is an excellent neurologist in this regard. If anyone sees this who is on the East Coast, she's a wonderful resource. Someone who has MAPS training. This has been invaluable for me. The Medical Academy of Pediatric Special Needs, the Autism Research Institute, and the Neuroimmune Foundation is an organization that focuses in on providing healthcare professionals education for conditions like PANS and PANDAS, some conditions that some of these individuals also struggle with. So these are all suggestions for you to be aware. The kind of people you're looking for would hopefully have some of these qualifications, and you'll be able to pull together the kind of team that we are discussing. What do you really want to do when it comes to your primary care or your ER? You want to be able to reach out, if you can, in ways that provide the least disruption to the individual in question. Home visits, blood draws are great, and you can access that now. There are a number of companies that do this. It makes a world of difference, trust me. Building a relationship in the ER or the hospital with perhaps community liaisons, people who are devoted to developing, planning, coordinating system-wide district activities within the community. This is to try to enhance relationships. These people would be some of your first stops on how to best provide a level of accessibility for people you know when they have it, when they have needs or when they have emergencies. Building relationship with people right through the receptionist up to the MD. Why all these people? Because they will be the ones with whom you interact. Clearly, you're going to be talking to receptionists. Once they know your family member or the person you're caring for, they will know that this is a priority. They will know not to schedule them in the midst of a chaotic workday, if for a routine appointment. All of these people play a role. And if you can help them be even minimally familiar with your loved one, that will make a world of difference in promoting good health care and without disruption. I'm going to round it out in the final one or two slides with transition resources. And there's a lot of information here. You'll be able to find this on your own. But perhaps one of the most valuable toolkits is something called gottransition.org. It is a wonderful transition kit that takes a person from the pediatric to the adult healthcare phase. And you can see it here on the slide. A variety of tools, not just for the family, but for providers as well. And it goes right through the line of complex patients with or without developmental delay. I think it's something that is invaluable. And many healthcare organizations are actually putting this into practice. The next slide here is quite busy. I apologize, but I will call your attention down to the second to last bullet point. Vanderbilt Kennedy Center has a wonderful package for making this transition happen. Clearly, you're not going to need every single one of these, but I'm going to offer these, and you can look at these on your own time. These are some wonderful resources for people who, and again, I implore you to start the ball rolling and start getting familiar with some of these toolkits and resources before your individual in question, the loved one, your child, whoever turns 18. This is going to be incredibly helpful in that transition. And then finally, Harvard University even has a few resources, and I put that on there as well. If you're on the East Coast, you can look at that. Thank you so much. I know that there's a lot of information here, but my hope is that this has been helpful for you and your loved ones.